Great. Good afternoon, everyone. My name is Jacqueline King. I'm a practice facilitator with Health Teamworks. It's nice that you've all joined our community learning call, the first one for the second module. It was a pleasure to meet many of you last week in person for the Module 2 in-person training as well. So I really hope that you find value in this community learning call. Specifically, Module 2 will focus on population health management and health IT enablement. So for those of you that were able to participate and or hear the recording of last week's in-person training, we focused a lot of time on getting resources to different data, knowledge and information for your practices that you can use to better understand the health and social needs of your patient population. So today and subsequent community learning calls will really be a follow-up and an opportunity for you to engage specifically with the speakers about the data sources and dive in deeper with any questions you may have about additional services specifically from DHIN, as well as how you can use the data on an actionable basis in your practice. So with that, I will pass the ball over to Lakeisha Moore with DHIN to kick us off. Lakeisha, you should be able to have control.
All right, great. Let me get ready to share my screen. And just take this in a full screen. Thinking about it now. Okay, you guys should be able to see my screen now, and I'll go ahead and take it full.
Yes, we see it. Thank you.
Great. Welcome, everyone. We're glad to follow up with many of you that we were able to talk to in person at our last session together at the in-person training session. And then today, you'll notice that some of the slides are actually similar to what we went through before. One, because I recognize there's a lot of information that is thrown at you during those in-person sessions, so it's always good to kind of review, make sure that we're on the same page. And then two, we're going to go a little bit deeper into analytics and CCDs specifically today. So I'm Lakeisha Moore, Director of Provider Relations, and then I also have one of our newest team members for DHIN on the line, who is Angela Kaiser. We affectionately call Angela Angie Kaiser, who's our Clinical Informatics Officer with the DHIN. So both of us will kind of tag team this presentation, and we want to make it where it is conversational. If you guys have questions, feel free to I'm not sure if the lines are unmuted, but definitely you can put your questions in the chat as we're going through. We, like I said, are here to help and make sure that everybody kind of understands some of the services that we're developing at DHIN and also the ones we have available. So today, what we're going to do is I just did our introductions. We'll talk a little bit more around the practice milestones and specifically how DHIN Analytics can help with some of those state innovation model practice milestones that you may be working on. And as we talked about in the last in-person session, even if you have some other metrics that you're working on through an ACO or just maybe your specialty practice and you're not necessarily working on specific ones for primary care, specific milestones, just keep in mind that a lot of our services really can be tailored to fit whatever metrics and milestones you may be working on individually at your practice. So we kind of use the 9 primary care milestones as a guide, but of course we can definitely try to help meet your needs with whatever metrics and milestones you're working on. I'll also do a demo of the DHIN Community Health Record, specifically looking at care summary documents. I know that Angie will talk about that a little bit in the analytics part. So it's important to, one, understand where those care summary documents that you may be sending or thinking about sending if you're working on MIPS, and that's one of your advancing care information. What do you call it, like one of the points you're looking for is to do HIE exchange by sending in your care summary documents. I'll show you how that works and where that information shows up in the DHIN Community Health Record. And then lastly, we'll close out with next steps of how you can get started with anything that you have seen today, or if you have additional questions, next steps that you can take. So just as part of our learning objectives, we always like to kind of lay out exactly what we want to achieve as we go through the different slides in this presentation. And the demo is, one, we want to describe how DHIN Analytics align with the core Delaware State Innovation Model Practice Transformation milestones, so we'll go over those. And then we'll identify ways to leverage DHIN products and services to achieve practice transformation milestones and improve patient outcomes. I've also put the improved patient outcomes in there. Once again, if you're not specifically working on these milestones, of course, a lot of these products and services overall can help you improve those patient outcomes. So the slides that I have here, I just wanted to kind of level set with many of the products and services that DHIN has available to date. And this is a slide that our CEO, Dr. Lee, shared during our last presentation, our last time together. And it really does show how when DHIN first started back in 2007, and you'll notice on the bottom half of the graph that we talk about FY08, FY09. We typically will look at our services during a fiscal year. So that's what that stands for. So DHIN started back in May of 2007, so that was our first fiscal year. We kind of look at it as fiscal year 08 since it ends like that next June 30th. So actually we're coming up on the end of our fiscal year here. But this is just to show you many of the products and services that we've built over the years. Now we're up to about 18 different products and services you can kind of see over to the far right. And a lot of the services that we're developing now are truly based on practice feedback, practice level feedback. So as you tell us, hey, we're having challenges with patient engagement, or we'd really like to see more around analytics. I mean, those are the feedback that you guys give us. That kind of helps us, and also just looking at the changing landscape in healthcare helps us to kind of develop where we're going next. So this last fiscal year, both of the products that you'll see here or services that you see here deal with patient engagement. And what we call now, we kind of use the term patient and consumers interchangeably, but what we're finding is patients are becoming more engaged in their health care, and we want that. We want it to be where patients really kind of understand and can partner with their health care providers to get the best outcomes. So we're developing, as we talked about during our last in-person session, a personal health record where patients can either go through your portal and then DHIN can just provide some of that additional information, additional clinical results that they may have had at other places. They can now come to your portal and get all that in one place. Or if the patient just wants a place to kind of start putting all of their different labs and radiology results, DHIN can give them access to the portal, and then we can do what we call a co-branded model where we would put your practice logo on that portal too. So that's something that maybe we can do if there's interest in a later session, really do a nice demo for everybody on the line. But I just wanted to kind of give you an idea of the many products and services that DHIN has available. Many of you probably started with DHIN, and our core services are what we call results delivery, where we'll take tests that your practice orders and we'll deliver them either into your electronic medical record if we have an interface available, and most of the big EMR companies we do offer that connectivity, and then many of you also have access to the community health record. So those are our core services. Those are the ones that have stayed within through the years, and that's typically where we get everybody started. But I wanted to give you guys an idea of many other services you have available. And I don't know if there's chat, if it'll pop up for me or anything, Jacqueline or Sarah or Angie. So if you guys see something, just stop me and let me know if there's questions that come up, because I definitely will. I'm open to answer any of those as they're coming up. I'm just not sure how I'm alerted if there is something in that.
I will. This is Jacqueline. I'll absolutely let you know, Lakeisha.
Awesome. All right, and then as we've grown over the years, once again, from starting in 2007, we are now upwards of about 27, 28 data centers. We're actually kind of running out of space on our slide here. So I'm like, we're going to have to redesign this. But all to say, we really, when we talk about and more data centers, all of the data that we have in the DHIN Community Health Record comes from our hospitals throughout the state of Delaware. We're now also receiving what we call ADTs. That's basically anytime there's an encounter done, even in the Maryland and D.C. hospitals, we have a connection with CRISP, which is kind of the DHIN version of the HIE, or Health Information Exchange, over in the Maryland area. So we do the same thing for CRISP. We send anytime there is an encounter in a Delaware hospital on a Maryland patient, we send CRISP an alert about that encounter. So CRISP does the same thing for us. So you might see some of that when you log into the DHIN Community Health Record, or if you subscribe to our event notification and one of your patients goes over to a Maryland or DC hospital outside of the state, you can get an alert about that particular encounter. But these are all of the different sources that are available for you in the DHIN Community Health Record, or these sources like some of the MedExpress of the world, the CNMRI, who does radiology. They're also sending us what we call CCDs, those care summary documents, so you can see if one of your patients went to urgent care, exactly what transpired there. So I'm sure many of you are very familiar with the practice transformation milestones if you're working on these actively as a part of practice transformation. So I won't necessarily go through and read all of them. Today we're going to focus on the milestones that specifically tie back to analytics and how DHIN can help you with those specific milestones. So I'll kind of go back past those, but if you look at this slide that we showed last time, we kind of highlighted milestone 1, 3, 6, and 7 when it comes down to analytics. So that's what Angie, I'll pass the ball over to her, and I'll still do your slides, Angie, but definitely I'll kind of pass it over to you here to talk about a little bit more of our analytics platform and how we can assist with these specific milestones.
Thanks, Lakeisha. Sounds great. Hi, everyone. I'm Angie Kaiser. As Lakeisha introduced me earlier, there are, as she alluded to, tons of different ways that our services can be used to help you, not just with your practice transformation milestones, but we chose these to review since they could be areas that you're actively involved in right now. With that being said, the examples I'm going to give are just the tip of the iceberg, and really analytics, the whole functionality of analytics is to give you some insights into where you can focus your attention to improve operations or improve your intervention process to make sure that you're really following guidelines, to provide you call lists, that sort of thing, so that you can focus on your high priority patients, so on and so forth. So it really opens itself up to anything related to being able to truly see that patient from point A all the way through the spectrum of health care and make sure that you're coordinating care and providing the best care possible. With that being said, milestone number 1, identify the 5% of panel at the highest risk and highest priority for care coordination. Basically with that, I will tell you our analytics platform, there's a few different ways that it can be utilized, and just to give you a very high level, we can do queries and run reports for you based on what you're wanting to look at. We can provide you the raw data so that you're able to run your own analytics if you happen to have an analytics tool in your practice. However, we recognize that a lot of the mid-sized to smaller practices typically don't have analytics because the tools are pretty pricey. And then we have a third option available out there where we can kind of give you your own little corner of the universe in our data so that you have access to your data and our tool to be able to run analytics on your own instead of request through us when you would like access to certain data or wanting a report on certain. Help you query the data and identify patients that meet high-risk criteria. So an example of that would be, if you're wanting to look at patients who have 2 or more comorbidities, or if you're wanting to look at your patients that have been admitted more than twice in the past, we are able to help you identify those patients or even those populations so you know where to target in and focus your attention to. I'll say this is definitely interactive because you may have questions. A lot of these discussions they get a little overwhelming if this is your first couple times of talking through analytics and reporting and understanding how you can operationalize that. But I'll move forward to number 3. The milestone number 3 is implement a process of following up after patient hospital discharge. Now, there are several different platforms, as you saw a couple slides back, where Lakeisha had check marks in all the different types of services we offer that can help you with each milestone. And this is another one where our event notification letting you know that patient's been discharged can help you. Where this also can help you to focus on the analytics piece of things is based on if you have a significant significant amount of patient population that is admitted and discharged because you are a larger practice, or maybe you have a lot of higher risk patients, that sort of thing. Analytics can be used to help you with determining your outreach call rosters, for example. So if you wanted to just focus on, let's say, patients who have been discharged in the last 72 hours that had a diagnosis of diabetes that were from your practice, and you wanted to just focus on calling them, this would be another way that you could do that, as opposed to if you have a significant volume, using the event notification and compiling your own list, which takes some manual efforts. And that's the best example I could think of to help you. There are others, and all of you listening to this have so much experience of where you need to focus your attentions that we'll talk about this in a little bit, but I would love to hear where you could see where that could help, and we can certainly work together to come up with additional use cases and identify those reports for you as well. But with milestone number 6, we'll move on. Document a plan to reduce emergency room overutilization. This particular one, milestone, we are actually helping one of the Delaware ACOs, and Lakeisha, I don't even know if I'm allowed to mention who they are on this call or not, but basically we're helping them look at their ED utilization and their unplanned admissions, and they came to us saying, we don't know where to start with an issue, but we know as an ACO that we are definitely having too many patients with unplanned admissions. And so we came up with a roll-up report for them that actually says, by provider, this is the number of admissions that occurred in the last 90 days through the ED, with the assumption that these were unplanned admissions. The doctor didn't send them to the inpatient environment. They showed up at the ED with an exacerbation of whatever their issue is, whether it be heart failure, COPD, et cetera, and they were admitted to the hospital. So they were able to take this report, and what they will do with it is prioritize, okay, here's our top 5 or our top 10 providers who have the most unplanned admissions. And so it doesn't tell you what is going on with them in this particular report, meaning why is it that we're having these admissions, but it tells you where to start and focus your attention to drill down with those particular providers, for instance. Some future things with our analytics ability, and we'll talk about what it takes for us to get to this point, and it has to do with data, sending in particular data. But in the future, what we'll be able to do is actually look at things like interventions and outcomes and be able to, that's called regression, doing a statistics thing called regression. And those will tell you where your issue actually is, more so than the big picture of here's where you need to focus your attention. And an example of that would be, so you notice that you have a significant number of patients being readmitted by Dr. Smith. Well, you can actually look and then say, what is Dr. Smith doing differently from an analytics perspective? With his data, what is he doing differently that correlates to those more frequent inpatients? And it may show that for heart failure, he does not prescribe a beta blocker, and the other providers are, and that looks like an indicator, a statistically significant indicator as to why he has greater inpatient admissions, and that's just an example. There's a lot of other ones out there as well. But that's something that we would love to be able to do and help you with in the future. Right now, we can point you in the direction to say, here's where you want to focus your energy and effort to cut those down. But in the future, when we receive more CCDs, more summary documents for more providers, we'll be able to do the regression piece of things and actually look at what interventions are being done that lead to less readmissions, and what interventions seem to be done or are missing from being completed that lead to more admissions. So with that being said, are there any questions at this point before I move on to milestone 7?
Okay. This is Jacqueline. I don't see any in the chat, but if you folks want to verbally chime in with questions, there's a little microphone to the right of your name, and it's red if you're muted. Just click it, and it will turn gray. So feel free to also chime in that way. Okay. Thanks, Angie.
Jacqueline. Okay, I'm going to move forward with, did somebody come off to ask a question? No, it got loud. Okay, milestone number 7, implement the process of contacting patients who do not receive appropriate preventative care. So there's a few different ways that analytics can help you with this particular milestone. I came up with an example just to kind of get you thinking through this. But for instance, being able to run a query through the DHIN with all of the data that we have, looking at diabetics who haven't had a hemoglobin A1C test in the last 6 months, which follows clinical guidelines on best practice. And then those patients that have a history of uncontrolled diabetes, the clinical guidelines recommend that they have a hemoglobin A1C every 3 months. And those of you that are clinical on the phone get this whole thing, I know. But for anybody who maybe isn't as clinical and is curious what that means, basically hemoglobin A1C looks at your average blood sugars in the last 90 days. So for this particular process, we can query and look at diabetics who did not have a hemoglobin A1C in the last 6 months, which is an important preventative care to make sure that there aren't spikes in blood sugar that are lasting for a long period of time, which we know it increases the risks of diabetes and all of the complications. And then again, we can look at people who are considered history of uncontrolled diabetes if they've had one in the last 3 months. And then basically that gives you a list of your patients that you would want to reach out to and say, hey, we know we don't have a current hemoglobin A1C on file for you. We haven't seen you. We'd like to make an appointment and have you come on in. And it helps you then proactively monitor your diabetics a little bit easier. Some of you may have EHRs that can do a little bit of that with you, but I provided this very simple example just because as we get more and more complex, it gets a little more overwhelming, and this is kind of the more basic intro to all of this for everyone on the call. So there's other ways that we can help you with milestone number 7 outside of diabetes. This pretty much applies to any diagnostic group, any diagnosis that you can think of that we could do different analytics against. And Lakeisha, if you would like to forward the slide. So the most important part is how can we help one another? So I alluded to this in the previous slide, but a big thing that would really be helpful for what you can do for us is to help share use cases for analytics services. I'm a nurse by nature. I teach informatics and analytics, and I know a lot of use cases generally speaking, but I've also found that regionally and even within the state of Delaware, if you're north versus in southern Delaware, you have different issues going on with your populations of patients, different concerns. So sharing with us, hey, we could really use something that would help us do X, Y, and Z, gives me a good idea of where to focus some of our attentions to help you. And so I'd love to hear about those things. I would love to hear your ideas, your questions, those types of things, because it helps us to be able to service you better and more thoroughly. And then also participate in a DHIN ecosystem, and that means sending CCDs, your summary documents. We have several providers that are sending CCDs to us today, and we are able to use that data to help in looking at different querying and different analytics reporting. However, the more robust it is, the better it is. So the more providers who are sending us CCDs, the better a better job we can do at actually looking at a patient across the continuum of care when they see specialists, when they see other physicians, and being able to put all of those health practices together to paint a full picture. The other thing you can also do is help partner with us to pilot new ideas. So if there's something that I haven't discussed here and you're thinking, wow, analytics could really help me in this other area, let's talk about it. And I would love to pilot with you and get something off of the ground. And, we even have some, ability to incentivize doing that, where we can do a low cost or no cost pilot to see if what we can do will help you. And then we have that report available to other providers out there as well. And vice versa, most importantly, is what can the DHIN analytics team do for you? And again, it goes back to brainstorming on analytics reporting solutions with you, understanding what's keeping you up at night, where your challenges are, and how we can help you solve those problems. We can brainstorm together. We know our data. We know the data in our database really well, and we know analytics really well. So working together with your concerns and issues in your practice that you're focused on right now, even if it's not the milestones, maybe you have some internal goals that are established that you're really struggling with knowing where to start or how to measure or monitor your improvement or that sort of thing. We would certainly love to brainstorm with you on that and see if there's a way that we can help you. And then the other thing, too, is providing the reports, the data, or your own analytics platform. And I spoke about this earlier, but just to summarize again, we have the ability to provide you those reports yourself, so you have the data in front of you to start working with, already sorted, organized, et cetera, based on what the criteria are that you're wanting to look at. We have the ability to just send you data so that you can do your own slicing and dicing if you have your own analytics platform. And you may be saying, well, we already have our own data. How does that help us? And what we mean by that is the marrying of that data. So maybe you have your data, but you may not have data in your system that tells you every time that patient's been admitted somewhere, and you're wanting to look at that type of information. We can help you by sharing some of that data with you, or thirdly, your own analytics platform. So meaning in our ecosystem and our analytics platform, you could actually have direct access to log in through a web platform and go in and analyze your own data and look at your own data in our platform. And so any of those three things are ways that we would be able to help you. We would love to help you and even just talk through any questions you have related to that. Does anybody have any questions? If so, as Jacqueline indicated, if you click on the microphone next to your name, if it's red, it'll turn gray, and you are welcome to speak up or enter something in the chat section. And I'll wait just a moment to see if there is anyone with a question. And if not, then I believe I turn this back over to Lakeisha at this point.
All right. Any questions at this point? All right, well, as you have different questions that come up, and I know many may even share this or watch this a little bit later since we're recording the session, at the end I will definitely give you information for our DHIN service desk in general, but also most of you on the line should have a DHIN relationship manager, so I will share that information with you too. So feel free to reach out to either. And then, like I said, Angie is fairly new with us too here at DHIN. We typically will loop her in when you have analytics questions because she is our resident expert, as you see through the presentation. It's wonderful to have another clinical person on the team that has this level of expertise. So thank you so much, Angie, for going through that. And even if you have questions as we continue on, feel free to put them in the chat or speak up, let us know, and we will go over those questions with you. So I'm actually going to get out of the presentation now and the slides, and I'm going to do a live demo for you for the DHIN community health record, because one of the things that Angie talked about was your data. So it's funny, when earlier in the presentation when I went through that slide that showed all of the DHIN data senders, and I was like, oh, we're running out of space, which is a good thing, you know, more data, that gives you a more complete picture of what's going on with the patient, because patients don't just stay at one place, as we've seen, especially in Delaware. There's definitely a lot of borders that you can go across to get care. So as we have more data on the patient, you get a more complete picture of what's going on. It cuts down on duplicate tests. Just a lot of positive outcomes there when you have the full picture of what's happening. So the DHIN Community Health Record is one of the places that we can provide that information at the patient level. But, of course, what happens in your practice, now you can become a data sender too. And so that's the importance of care summaries, especially if you're looking to utilize the DHIN Community Health Record or some of the DHIN services to help you kind of figure out what's going on at my practice. It gives you the benefit of having your data from your care summary documents that you're sending to DHIN, and also any other data that may be out there on the patient. So let me go ahead and log in for you to the DHIN Community Health Record. So most of you have access to the DHIN Community Health Record. If you don't, we'd love to get you enrolled and started on the Community Health Record. Right now I'm actually going to log in, and we're going to look at a test patient together. My password's about to expire, but I'm going to go ahead and do that a little bit later. I've got 3 days. So when you log into the DHIN Community Health Record, the first place that you'll come is what almost looks like a Google search. So we kind of call this like our local Google section when you're looking for patient health data that may have been generated from one of our data centers. So the most common way to search is by last name, first name. So I'm just going to put in test, Amy. And once again, our focus today is not so much, I'll go through the full DHIN Community Health Record demo, but our focus today is to talk about those care summaries that your practice, if you're not already sending in care summaries, that your practices can start sending DHIN. The wonderful thing about our care summary program right now is it is grant funded, so it is free for those EMRs that we have a connection with. And you know what? I will make sure, Jacqueline and Sarah, if you guys don't have the list of EMRs that are participating in CCD Exchange already, I'll make sure as we follow up with this presentation to send you guys a list to share with the practices, because I didn't think to put that, I don't think I put that in today's presentation. But most of our bigger EMR vendors, the Cerners of the world, STIs, I'm trying to think of some off the top of my head. We have about 10 different connections right now, and we focus, Allscripts is another one, on a lot of the bigger EMR vendors. If you have a question about yours in particular, chat it to me, and I can let you know if they're on there or not. But a lot of those EMR vendors we have automatic connections with, so if you want to get started with sending us your care summaries, then it's just a matter of reaching out to your relationship manager, letting them know, hey, we're interested in sending our care summaries to the DHIN Community Health Record. That helps with that. Once again, if you're doing MIPS and you're looking for some bonus points there, that's a great way for you to get your points, because those care summaries are now available for anybody else in the community, DHIN community, that needs access to those care summaries, and it's nothing out of your workflow. The care summaries automatically, when you close out your patient encounter in your electronic medical record, the care summaries are automatically sent to the DHIN Community Health Record. So it's not like you have to do an extra click or, do something outside of your workflow. It just kind of runs in the background. So once again, I'm in the Community Health Record. Talking about is when you log in, you'll see, hey, we've got care summaries available. We've got a little over 1 million in the Community Health Record now, so thanks to those on the line that may already be sending the care summaries, and we definitely want to continue to have that number grow. I'm going to go into Test Amy's account. So all I did was put in her name, and then I hit search, and you'll notice that 2 came up for me. So I always say when we're doing our trainings, for your practices, that make sure you've got an identifier, another identifier in addition to the name, to make sure you're going into the correct patient record. And in this case, you notice that this patient came right up for me. And this is because this patient has actually been seen by one of the providers in my test practice here. So whenever you've got a relationship with a patient, remember that patient will automatically come up for you, but you'll only be able to view initially what your providers ordered on this patient. So Test Amy, I actually want the one that was born January 1st, 1955. I'm not going to hit Access Additional Records yet. I'm actually going to show you how you can do that while you're in this patient's chart. But that is an option. If you want to say right now, since Test Amy came up for me, everything that I see in her account as of now will only be the things that my providers either were ordered, they were the ordering provider, or they were copied on. But if I wanted to see kind of everything that's available out there, whether my providers ordered it or not, I could hit the Access Additional Records now and just choose a reason. And the most likely reason, because it is one of my patients, is I have a clinical relationship with this patient that's not established in DHIN. Once again, I'm going to do that when we actually get into her record. So now choose Test Amy, the one that I want. I just clicked on her name, and now I'm in her record. So I'll walk through a patient chart pretty quickly, and like I said, we'll camp out a little bit longer on the Documents tab, which is where the care summary documents that you're sending in or other providers are sending in for this patient will land. So in the patient summary section, and this will give me the most 3 recent encounters for this patient. So I see, okay, she's had some things done back in 2014. These were the top 3 things. All right, these are her most recent labs that I have access to. She could actually have some more labs out there, but once again, since I haven't accessed additional records, I don't see that right now. I'm just seeing the things that my doctor has ordered, and then I see that she had a couple of x-rays done too. If this patient had discharge summaries or consults done in the hospital, I would see that here. And right here, the care summaries, we don't have any care summaries in here yet that are showing up, but I'll show you what a care summary does look like when the patient does have it in the record. I will say right now, I believe we're at close to like 1/5 of our providers are sending in care summaries. So a lot of times when you go into a patient record, you may not see the care summary document there. But once again, I'll show you what it looks like so that you can start looking for those care summaries as we get more people and practices sending in care summaries on the patient. All right. So I'm going to go now to the next tab. Patient summary, once again, is just a summary of those 3 most recent encounters. Remember, the types of results that you get in the DHIN community health record are your labs, radiology, and then your transcribe reports, which are like your discharge summaries and such. Anytime a patient has an encounter at the hospital, we'll go to that next tab. That's where you would see encounters. So here we say, okay, well, she had a few encounters, but this is where I'm thinking, especially if you have a patient that's in front of you and they said, yep, Lakeisha, I was in the hospital yesterday, and maybe they went to the emergency room, and you're thinking, okay, I don't see that here. Well, it's probably because the emergency room maybe did not copy one of my test providers on those results. So at any time while you're in a patient chart, you can always access additional information or additional records may be available. This stays with you throughout the community health record. So right now I'm going to go ahead and access those additional records to see if I can find out what happened in that emergency room. I'm going to select my reason. This is one of my patients. Just it says I have a clinical relationship with the patient, but it hasn't been established in DHIN because that other provider did not copy me on this result. As a provider, many times if you're a staff member, there are kind of different roles in the community health record. In this instance, I'm logged in as one of the providers for this particular practice. So I do have this option to remember my association, which that means I won't have to access additional records on this same patient for up to 90 days. But most of your staff members don't have this little button here, so I don't want you to think like, oh, mine's not working when you go into the DHIN community health record. It's just this option is only given to your providers. So typically you will have to access additional records each time that you go into the DHIN community health record. So I've got a clinical relationship. I'm accessing additional records. Let's see if I can find out about that ED visit. Okay, yep. You see how many more results that we weren't copied on? And because, once again, everything that we saw initially was because one of our providers did it. But these other results were ones that our providers weren't copied on. So when you access additional records, that gives you anything that patient has had done will now be showing up for you. So here I'm going to go ahead and click on one of these encounters so you can see what happens. Many times when you have a patient that has an encounter in the hospital, of course you want to see, well, what happened? So during that particular encounter, I see, okay, this patient went in, they had some labs done, and I can see, if there was anything abnormal with those labs, that'll come up in red for me. And in this case, I'm actually going to create what's called an encounter summary, where if I wanted to take this encounter and either print it, or if I wanted to, the encounter summaries actually do come across now as CCDs. So you could actually download this encounter summary, and if you wanted to upload it into your system, so you would now have that information in your electronic medical record, that is an option for you. So I'm going to create this encounter summary just by clicking on this button, encounter summary. And I will tell you that for the encounter summary, or that we consider this a care summary document, you see where it ended up landing is on the Documents tab. This is a new feature as we upgraded our system now a couple of years ago, so I am finding that some users do not have this functionality turned on, but it is something that you can turn on yourself because all of your organizations have been enabled for you to create care summaries. The way you turn it on, if you happen to go into your account in the DHIN Community Health Record and you're like, hey, you know, I'm not given that encounter summary option to create a care summary document, you can just come on under account preference, come under your name, go into account preferences, and then if you go under features, you'll be given that option to create CCDs. It'll be a toggle switch for you, so you just turn that on. So just wanted to show you that in case you happen to go in and you say, hey, I don't have that button. It is something that you can enable yourself. So let me go back into the chart. And go back to documents, and I don't think it saved it for me because I came out of there. Just kind of had a thought there in case that happened to you. So let me go ahead and create that encounter summary again so you can see how that's done. Encounter summary is created, and now if I wanted to, once again, print this encounter summary, I can do that. It's on the Documents tab for me, or I can download this. And once again, when you download it, it does download as what is called an XML type document, which your EMR loves. Your EMR kind of understands that format. So it may look like gobbledygook to you when you get it and look at it. You're like, I don't know what this means, but it's in that format because that is like the standard format for an EMR to be able to ingest that particular care summary document, and it should parse out or separate out the different fields, so the labs would go under the labs for that patient, or if they had radiology, it would go under your radiology section within your EMR. That's kind of the intent behind the care summaries being in that XML format. Questions up into that point?
I do not see any questions in the chat at this moment.
Okay, no problem. So again, encounters just will let us know, hey, patient was in the hospital. If I want to know what happened during a specific encounter, I click on that encounter, and if there's, and once again, it's a test patient, so not a lot of will come up here, but if there were labs, radiology, anything that was done during that particular encounter, I could see it here, create that encounter summary, and then I could either print or download that. Where most of you will probably hang out when it comes down to the DHIN Community Health Record is in the Results tab, because this is where everything clinical lands. So all of your labs, radiology, transcriptions, pathology, and we've even added some new result types, cardiology. So as we get more results that come through the hospitals or different, like if we have a cardiology practice that begins sending us their specific reports, we can actually label those as cardiology. So just trying to make the report types even more granular. What you'll see in here now, once again, is if I wanted to look for a specific type result, like let's say the patient said, yep, I had a chest x-ray done, I can just start typing in radiology here in my dynamic search, and just the radiology results will come up for me. Or same deal, if I'm looking for, let's say the patient had a CBC done, I could just start typing in CBC. So that is a new feature that a lot of the practices have said they enjoy and appreciate, just because it's a way that you can kind of start quickly looking for information that may be available on that particular patient. I won't spend a lot of time camping out there. If you ever want to have any other type of tutorials, deeper dives, we do have this information on DHIN.org. Under resources, there's some videos that kind of go through exactly what I'm going through here. I'm going to camp out on that Documents tab a little bit longer, just because we're talking about those care summary documents. So one other tab that I will show you is the Medications tab. For many of you, this may actually not be enabled right now. And actually in this account, it's not enabled for me either in this test account. But I do also like to let you know that if you're ever in need of medication fill history, that is a service that DHIN does provide. It is a subscription-based service, so once again, your relationship manager can go over that with you. A lot of times we'll have you try out the service first and just make sure it's kind of getting you the information that you need to fill in the gaps, and then if you want to continue on with the subscription, then we could definitely go over how you would would do that. But what's nice about the fill history is it is national, and it is a 12-month fill history, so not what was prescribed, but what the patient physically went to the pharmacy or went to actually have filled. So some people kind of like that part of it because you can see, hey, their A1Cs aren't coming down, and then you recognize, oh, wow, not showing that they filled this prescription in over 90 days. Doesn't mean that that the patient didn't. Maybe they went outside of a source that we didn't capture. But one of the things that we've seen when we kind of piloted this is we capture about close to 98% or so of the fills out of the population that we studied. So, I mean, it seemed to be a pretty good match rate. So sometimes can give you some insight into what might be going on with your patients, or if they're getting medications from somewhere else, then you can kind of see that too. So let's go ahead to the Documents tab, and that's where we'll kind of end up our discussion today. I'm actually, because this is a test patient, and I know the only document that we probably have on there is that encounter summary that I created. I'll show you another way that you can create care summaries in the community health record. But remember, as your practices start sending more of those care summary documents or other practices that see your patients, you can go to that Documents tab, and care summaries will already be there. In this case, we're going to actually create a care summary. And once again, this is something that you can do now with your DHIN Community Health Record access. As I create this care summary today, what's actually going to be in this care summary is everything that's in this patient's chart. So sometimes for your new patients, that could be a great use case for you if you don't want to have to kind of go back and figure out, hey, labs and radiology and trying to pull that individually. You could actually create a care summary and, once again, download that and then import that care summary into your EMR, and that gives you a jump start on getting a lot of that patient data into your EMR. So I'm going to go ahead and preview this first. And see, the only option is all data in the community health record. And so now I've got all of that information that was in here on that patient is now available in one one continuity of care or CCD document. And so I could just print this, so it would just be like a PDF if I printed it. And, of course, you can use that if that's a little more user-friendly for you. But if you actually wanted this to be parsed out in your EMR, then, of course, you can download that care summary document and then import it into your EMR and have that information available. But now let's go to the Documents tab. So typically we go to the Documents tab. If there is a care summary document available, you will see the care summary document. You would see, in this case, I'm the author because I just created it. But the sending organization now, like I know I've gone in and I've seen some from like Mid-Atlantic Family Practice. That's one of our CCD sending organizations, Dr. A. There's a lot of other organizations out there that are sending in those care summary documents, so you would get to see who those care summary documents are actually being sent from. And then, of course, the care summary that I did earlier, that encounter one, that just showed me for that one specific encounter everything that happened during that visit to the hospital. But this is an idea. All the care summary documents are, for the most part, formatted the exact same way, no matter what EMR vendor they're coming from. I will say some of the EMR vendors, even though CCDs should be standard, I say the word should be, we find that some EMR vendors do not populate all of the different fields that they could. So you kind of, you're kind of at the mercy of what data is sent. There are certain fields that are required, but then there are also fields that are optional. So you may have to work with your EMR vendor if there are certain ones that you want to be included in your CCDs, and just ask them to make sure those are included. So this is where you would find your CCDs as your organization sends in CCDs, or you're thinking about sending in those care summary documents, i.e. CCDs. This is exactly where they would land, right on that Documents tab, and they would be available for the others in the community. And once again, that can help you with your MIPS measures. So there's a lot to take in there, but if there are questions, comments at this point, I will open it up and we can go over any of those.
Keisha, I also typed into the chat. I'm curious if anyone on the line are using summary of care documents or CCDs, and if so, if you'd be willing to unmute yourself and share your experience with us.
You should have showed us how to do that.
echo. Was someone trying to speak up? Okay, well, it doesn't seem like it at the moment, but please feel free to share that some of the benefits of having this call is that you can learn from one another as well. Thank you. And it seems like everyone is already unmuted.
Okay, great. Any questions or anything you'd like me to go back over while we're in the community health record, or anything that Angie covered that you'd want to go back over in regards to analytics?
Sure.
I think that's just background noise. Thanks, Lakeisha.
Okay. No problem. All right, so we'll do a wrap-up and next steps. So once again, at this point, we are kind of rounding out the end of our grant that we've had, and was awarded a grant, a 2-year grant in 2015. In 2015. So we do still have some of those services available, like the event notification, or we call it encounter notification service. Your CCDs, we're actually extending that for practices all the way through the end of the year. So I definitely, as you think about your different measures, or if you're looking to do more practice-level analytics, reach out to us, let us know, let your relationship manager know, and we'll be glad to get you started, especially if you've got an EMR that is already connected to DHIN. It's a pretty quick process getting you started with that. As you said, analytics, we definitely are looking for other use cases there. Reach out to your relationship manager. Let us know if you've got some specific case that you want to look at, maybe if you're still working on your milestones of each.
There's a little bit of feedback. Heather, can you just mute folks? Thank you. Thanks.
No problem. And let us know. These are all of our different services, and once again, this slide deck will be shared, and I know this is recorded too. And so lastly, insofar as your relationship managers, if you're curious about, I'm not sure exactly who I'm assigned to, this is kind of generally the territories that we cover. I cover most of the practices that are on the Christiana Care campus and over in that area. Jamie covers Nemours, St. Francis, and the Union Hospital practices. And then Mike, Garrett, and Ed, many of you may be familiar with them. I think they're on the call too. Mike kind of covers the southern part of our state, so Sussex County, if you're down in that area, or with Nanticoke, PRMC, and or AGH, so we kind of go a little across the border there too into Maryland. Definitely reach out to Mike. Garrett covers kind of the middle of the state, so all of Kent County, and then he goes up into Middletown and the Newcastle Bear and some of the Newark area, and then Ed covers the top of the state at the Wilmington practices. So wherever you fall there, definitely reach out to your relationship manager if you want to follow up on anything that we've gone over today. And, of course, Angie and I are also available, too, if you have questions about the presentation in general. But that is all for today. We appreciate your time. I know how it is during lunch hour. You probably got a lot of things going on there, too, so I appreciate Jacqueline and Sarah for you guys recording the session, so that way others can go back and kind of review it as they have a moment. And if you have questions that come up afterwards, you know where we are. You know how to reach us. So thanks for your time.
Thanks, Lakeisha. And before we sign off for the day, I just want to take the back real quick and wrap up with a little bit of information about the next community learning call. So for some reason I'm not able to transfer it back. But essentially wanted to remind folks that the next community learning call, so number 2 of the series, is on June 29th, same time, so start at noon Eastern time. And this again is another opportunity to follow up about the QRUR, so the Quality Resource and Use Reports that Doral Jacobson talked about in the afternoon of the in-person session. Really encourage you to attend and come with proactive questions. So download your QRUR reports and ask questions about your value proposition or anything that's come up in terms of data that you're trying to use in your practice and trying to interpret as well. So please keep that saved in your calendars. And as Lakeisha had already mentioned, thank you all so much for your time today. If you have any questions, feel free to reach out to Bhavna, myself, Lakeisha, or Angie, and of course your DHIN advisors as well. So thank you all, and we will end this session.
All right, thanks everybody. Bye-bye.